Thank you. And I am going to share my slides here. Here we go. So welcome and thank you everyone for joining. And so I'm going to start off by telling a story because I'm a bit of a storyteller. I'm sure a lot of you know that this is a picture of an answering machine, which I was explaining this story to a young patient of mine who asked me how I got into working with boys and men with eating disorders, and he did not know what an answering machine was, which dated me. So I'm taking you back about 30 years ago when I was an undergraduate at Tufts University, and I took a class on eating disorders. It fit in my schedule. It was something that I had mild interest in. I was particularly interested in this psychiatric disorder that had some intersection with popular culture, and that was something of interest of mine. But again, mild interest. But within that time, there were two men who I was mildly acquainted with, who independently had shared with me that they had an eating disorder. And this was in the mid 90s, and before Google. And I'm the kind of person I like to help people, and so I remember trying to go through the yellow pages and white pages with them to try to find some support. And there was none. I mean, all the support groups that were for eating disorders were for women. At that time, any residential program were just for women. So these guys felt like they didn't really have a place to go to talk about this. And that really spurred an interest for me of, there's a gap here. And just in as a clinician and as a researcher, I'm interested in filling the gaps. And so as a result, I did my senior honors thesis on college men with eating disorders. And unbeknownst to me at the time when I did it, it was the first study that had drawn men from eating disorders from a community sample. And I have this picture of the answering machine because I had placed ads in I'm in Massachusetts. We have a ton of colleges and college newspapers recruiting men for the study. And I remember my thesis committee, who was fantastic, but they said, you might want to have a plan B because who knows how many guys are going to respond to this. I mean, we don't really know like how, if it's common enough that you're going to be able to have enough statistical power. Well, I remember the day that all the ads had gone out, and I had a long day that day, came home from class, and my answering machine tape was filled like to capacity from men who had responded and were overjoyed, were emotional, felt validated, were very excited to sign up for a study because they thought, I can't believe someone's going to study this. I thought I was the only one. We had paid subjects. Some of the men were like, you don't need to pay me. I just want a place to be able to talk about this. And that was the beginning of where I really started my interest in this. So before we talk about men and boys and this issue, just so we understand even the term body image, I mean, we hear this term a lot, but what exactly is it? So to clarify, body image is different from our appearance. So our appearance are the objective criteria of our physical aesthetics. I have brown hair. I'm 5'11". I weigh this amount. My eyes are this color. Like these are objective facts about somebody's appearance. Our body image is a little bit different. It is the perception that we have of ourselves, which as we'll talk about today, does not always have to align with appearance. It can be whatever picture people have of themselves in their mind that could be very different than how they actually look. It's the affect around that perception, the feelings we have about our bodies, the satisfaction we have with different body parts and shape. It's the cognitive domain of the thoughts we have about that perception. So, for example, if somebody thinks that they're unattractive, the thoughts that might accompany that might be, well, then what makes me think I'm going to be successful if I'm unattractive, or nobody is going to love me because I'm unattractive. And then how all of that influences our behavior and our actions, the situations that we might avoid because of that, or situations that we might enter into because of that. So body image is this real encompassing concept that integrates a lot of these different factors. Now, it's very pretty well documented, and I think from popular culture, we're aware of the history of body image with women has historically been one of oppression, of women being told that they have to look a certain way. There's a great book called Fasting Girls that really traces restrictive eating habits and anorexia into the 1600s, women being put in corsets where they literally fainted. And it really was, and to some degree, one could argue still is, ways of kind of having women be in a role of passivity and a role of being objectified and not be empowered in many ways. Now, with men, it's a little bit different. And this is where even when I tell people that this is an area that I specialize in, although I get it less now than I did 30 years ago, but I'll still have people being like, wow, I didn't realize that boys suffer from these kinds of issues. And I understand that because historically, when we think about body image with men, it's been more an emphasis on physical strength and function, the sort of the role that the body plays in being fulfilling these quote unquote masculine roles of being the protector, the fighter, the farmer, the athlete. So it's tied along to this sort of traditional notions of a masculine gender role. And body image is, for historically a lot of times is really tied to fulfilling these roles. And then if one can't for some reason through illness or in the case of impotence, then uh, men will often have a sort of more negative body image because their body is not fulfilling these particular roles. Now that started to change though. So even though we had statues of in the Greco-Roman era that really marveled at the muscular body. It was, again, really tied to the muscular body because that signified strength, which signified protection and all of these other things. The mere aesthetics for just the purpose of almost like an objectification. We started to see a difference in the late 70s and early 80s. And there have been multiple studies that have looked at body dissatisfaction over the years. And one particular study found that in 1972, 15% of males who completed the survey endorsed that they were dissatisfied with their body. In the 80s, that doubled to 32%. In the 90s, it went up to almost 50%. And that was in the 90s, 30 years ago. We know the rates of cosmetic surgery has dramatically risen amongst men. There was a particular inflection point in the 90s where the American Society for Plastic and Reconstructive Surgery cited that there were about 6,000 men in the US in 1992 that had liposuction surgery. And in just a 5-year period, that quadrupled to over 25,000 men. We know that fashion started to have a more increased importance with men, a higher proliferation of fitness magazines and magazines that were focused on not only men's health, but their physiques. And we know that the rates of eating disorders in males has become more recognized and increasing. And I'll talk a little bit more about eating disorders specifically. But first, I want to almost present a different view of how with men body image can carry a different sort of a different currency. Now, this was a study that I authored in, it was published in 2004, where this was inspired by body image studies that had typically been done prior to this, which would present women with illustrations of figures that range from a very thin, almost unhealthily thin image to an overweight image and then everything in between. And they would ask women, where do you see yourself? What's your ideal? What do you think men prefer in women? And almost always you find that women see themselves as having more weight than they actually have. Their ideal was often in a very unhealthily thin range, and they thought that men preferred an image that was thinner than what men that were surveyed actually preferred. Now, when they did the similar studies, when researchers did similar studies with men and boys, they found that some preferred larger images, some preferred smaller figures, and they kind of canceled each other out. And unfortunately, a lot of those authors surmise that maybe boys and men don't really have these issues with body image. Well, that actually is not accurate because one of the The problem with that is that they just measured body image based on one axis of body fat. And with males, something that really distinguishes them from women, typically, again, a lot of this is more in general terms with body image, is the axis of muscularity. And so there are a lot of the men and boys that I treat, they don't care how much they weigh. If that weight is in muscle mass, is very different than if that weight is in body fat. Whereas typically with girls and women, it's one and the same, that the weight, the number on a scale, is equivalent to their eyes as to the amount of body fat that they carry. So we did a study where we comprised this computer program called the somatomorphic matrix, and men could click an image and make it more or less fat and then more or less muscular. And then we actually measured the height, weight, and body fat of these men in the study. So it was a sample of 154 men, and we found that men perceive themselves to be slightly fatter than they actually were. It wasn't significant though. And they chose an ideal body with about 8 pounds less body fat. Again, not a statistically significant difference. However, when we looked at the axis of muscularity, we found that males chose an ideal body with 25 pounds more muscle than they currently had. And then we surveyed women, and this was a sample of heterosexual men, men who identified as heterosexual, that we surveyed women and asked them what their ideal was in men. And men thought women wanted them to be a lot more muscular and less fat than women actually preferred. Now, what was also interesting is that the notion of what we call fat exaggeration. So if somebody thought they had more body fat than they actually did, traditionally in studies of eating disorders and body image with women, you would find that to be a high correlation or risk factor for eating disorders. With the men in this study, we did not find that the men who thought they were fatter than they were or idealized less body fat, that correlated with any eating disorder inventories. However, what we call muscle belittlement, so the men who thought they were less muscular than they truly were, we found significant correlations with depression, with a drive for thinness, which might confuse people, but if you almost understand that thinness is also tapping into a drive for leanness, which is a little bit different. Bulimia, feelings of ineffectiveness, body dissatisfaction, and negative self-esteem. So men who scored high on these scales were also at higher risk for eating disorders. Now, it's not surprising when, again, even in 2024, that the imagery of muscularity really brings up these sort of notions of traditional sort of masculine values and virtues. One is stronger, has more power, gains more respect, often from other men, actually. You know, the big guys in the gym are, often getting admired by other men at the gym for their discipline or achieving a certain muscular body. A muscular body can convey threat, can convey attractiveness, confidence, can have imagery attached to sexual virility. And especially at young ages with boys being exposed to this, it starts to get intertwined with their identity in terms of how they start to see themselves in non-aesthetic ways. I'm just going to throw back a little bit. This is an ad that came out in the early 70s. Charles Atlas, who really promoted weightlifting regimens and bodybuilding regimens. But this gives you an idea of sort of what was starting to occur in the 70s. So the insult that made a man out of Mac. So the windows are small, so I'll just give you the gist, where a man and his lady friend are at the beach. This big muscular guy sort of kicks sand into Mac's face, and Max wants to stand up to him, but he can't because the guy is just bigger and more physically threatening. And that Max says, "Oh, that big bully, I'll get even someday." And the woman says, "Oh, don't let it bother you, little boy." Very, kind of emasculating statements. So the boy comes home, he's so upset. He gets this free book from Charles Atlas, and then lo and behold, he starts to develop muscles. And then he goes back to the beach and punches that bully out. And the woman says, "Oh, Mac, you are a real man after all." And the women in the background is like, "Wow, what a build. He's a hero. He's already famous for it." So clearly, as we need to be and have been, and not enough, paying attention to the imagery that girls and young girls are being subjected to as to what's being embedded and how they're being told about their bodies and what that means of them. This is what was starting to happen with boys, this sort of tie-in to having a certain body and being a man and what that means. Now, we're very familiar with a lot of the imagery, that sociocultural imagery that girls have been and continue to be subjected to. But what's less known in is, and less, I think, clinically appreciated sometimes, is the impact of that same kind of imagery for boys. And is there even media that promotes that? And, my theory around this, frankly, is that, in the 70s and 80s, advertisers, realized, well, we made half the population kind of hate their bodies and dissatisfied with their bodies and made a lot of money. So why not make the other half in that way? And I joke, but it's probably true that if all of us tomorrow woke up feeling 100% satisfied with our appearance, the economy might actually collapse because of all the industries that are really predicated on this notion that we're not going to like the way we look. So we may know of the Barbie doll study. That was classic study in 1980 that found if the Barbie doll were a real life human female, her dimensions would be completely unrealistic for an adult woman. And Mattel had gotten a lot of pressure from women's rights groups, body image advocacy groups, and did eventually change some of the dimensions, although one argues that it's still not, the sort of ordinary body. So myself and my colleagues in the mid 90s thought, like, what would be the analogy of that for boys? And we looked at action figures. And I went to a toy store and, with the permission of parents, asked their kids, their young boys, like, what are your favorite action figures? And so we bought those action figures and measured them and did a similar study and found that especially if you look at like Batman here, which is very different than Adam West, who I grew up with, their dimensions would also be very unrealistic. So this is G.I. Joe. Now, G.I. Joe has been around throughout decades. The G.I. Joe on the left is from the 1980s. If he was a real life human male, dimensions would be totally realistic. The one in the middle, updated in the early 90s, again, very realistic. The one on the right was from 1998, G.I. Joe Extreme, where if he were a real life person, his waist would be the same size as his bicep. In fact, he's so top heavy that even photographing this action figure kept falling over because he's so top heavy, not to mention the expression of rage on his face. Now, what's even more striking is one can argue, well, G.I. Joe is not the same person throughout those decades. There are different iterations of G.I. Joe. Well, that can't be said for Luke Skywalker. So when Star Wars came out in the 70s, they released an action figure line, which is on the left. And then in the 90s, they re-released Star Wars and digitally remastered and whatnot, and they re-released the action figure line. But clearly, Mark Hamill, who played Luke Skywalker, spent a lot of time at the gym. Even though it's based on the same character, clearly there was more of a push to to make the waist smaller, to widen the robe that he's wearing, show off his pectoral muscles. And it's been reported that Mark Hamill, who plays Luke Skywalker, when he saw the new action figures, said, "Oh my God, they put me on steroids." So, as a child of the 80s, I grew up with imagery where the Hollywood movie stars were not these debonair, dapper Cary Grant types, Humphrey Bogart types. They were typically men who their bodies were their currency, were their commodity. Your Schwarzenegger and Stallone, and that still continues with sort of newer, movies where the six pack and having, very strong muscles and definition is something that sells movies and has people sort of admire people. This is clearly, very different than Christopher Reeve of Superman before. So there's this real consciousness around, let's make the body fitter and tighter and more muscular, and what that conveys. And it's not just in movies. I mean, with music, and again, all of these things we've seen historically with women we started to see more and more attention to the male body in music, certainly in sports like wrestling, even in video games. So this is Duke Nukem, which was a very popular Nintendo PlayStation game some years ago. And the main demographic are boys between the ages of like 11 and 19. And Duke Nukem is a very misogynistic, militaristic, clearly very muscular guy. But even in the game, and this is right off the fan website, that uh, if Duke Nukem can find the hidden bottle of steroids, yes, anabolic steroids, he can maximize his strength and really kick some butt. And this is what they say on the website. Steroids make Duke move faster, kick harder, and more resistant to damage. But not only that, they can also restore his size when he's been shrunk. In Volume 1 3D, you could kick with both feet at once. It was always fun to trample my opponents to death while on steroids. Now, if we sit and think about this, I mean, this should be outrageous to anybody. I mean, if there was anything that said, hey, let's snort this line of cocaine to get this additional energy, or, let's ingest a bottle of diet pills. But these sort of get snuck in a bit under the radar. And I think culturally, because we either weren't thinking of these issues affecting boys, or it somehow is hard to even think about how these things could be affecting boys, but they do. I mean, men's magazines that are devoted to fitness, Men's Workout, Men's Fitness came out in 1987. And if you go to any supermarket, you'll see just as many magazines that are devoted to men's bodies and fitness. And a lot of them also talking and attaching, if you'll see on the headlines on the magazine covers, often refer to sex and sexuality. Advertising, which prior to the 1980s, you didn't really see a lot of unclothed men in advertising, even if it was for underwear and t-shirts and things like that. I co-authored a study where we actually looked at ads over the decades, and we found again this inflection point of the late 70s, early 80s, starting to see more unclothed men ads. Now, certainly it might make sense for underwear, but we started to see it for a lot of other things. Now, the reason I have this ad up is because this is a perfect example of really brilliant advertising. So Calvin Klein, prior to Calvin Klein underwear really selling in this was in the mid 90s. Most men, particularly heterosexual men, bought Hanes or Fruit of the Loom. That wasn't it. Like no one would drop $10 for a pair of underwear. And Calvin Klein pretty much had, more of an audience that were more of gay men. And so they wanted to really expand it out. And so they got Mark Wahlberg, who at that time was Marky Mark of the Funky Bunch. Look it up on YouTube. It's quite hysterical. And frankly, at that time, he was slightly homophobic, which he has talked about and has apologized for. And he has clearly a very fit body. This was slapped in Times Square, these big buildings, and clearly bringing someone who was clearly very quote unquote masculine, muscular, was a zeitgeist. I mean, it literally overnight changed how designer underwear was seen, and this continues today. This is off the Abercrombie and Fitch catalog, because I guess people just strip down in the middle of a football field. But as I mentioned, it's not just underwear ads. Men's bodies are used to sell salad dressing, are used to sell room freshener, pocket Scrabble, and it can never start too young, even for faster service in Verizon. Now, even though one could poke fun at some of these things, there is an element of what young boys are being subjected to. I remember years ago, and this was before social media, I spoke to a health class of seventh grade boys locally, and and my colleague who she worked with the women, with the girls, they were seventh graders, and I asked, "Oh, how many of you feel that you're kind of impacted by a lot of these ads and imagery?" And all the boys were like, "Oh, I'm not, like, that doesn't affect me at all. Like, I'm not," like, they were very quick to say how it doesn't impact them at all. And meanwhile, one of the kids, and I didn't, I want to embarrass him, but he was wearing his pants low enough that you can see he was wearing actually Calvin Klein underwear in seventh grade. And so there are ways, but then I asked, are any of your male friends impacted by it? And they're like, oh yeah, a lot of people get, but they're all saying that. And I think there's something inherently, and I've seen this clinically as well, where boys and men often feel shame even talking about the fact that they're even impacted by some of this stuff, that this even affects them, let alone if they have an eating disorder or other serious body image disorder. Now, social media has exploded these preoccupations in both boys and girls. And so you can look at social media influencers that and celebrities that post selfies of themselves and provocative, photos and with their very fit bodies. And there's an impact to that. The studies have shown that greater social media usage amongst male and female high school students predicted greater body dissatisfaction, appearance related discussions, and that what's really important is that it's not that the body dissatisfaction necessarily came first, that they found that actually that the social media exposure um, could then create more of that body dissatisfaction, because the more exposure you have to, wow, this is important, because clearly if I'm seeing it all the time, it's important, and this is what people are getting the likes for. Another study looking at adolescent boys and girls found that greater social media usage positively predicted the desire to undergo cosmetic surgery a year and a half later. There are apps that are not just designed for girls in terms of altering their appearance, swiping for more perfect skin, whitening their teeth, altering their nose. I mean, I've worked with even teenagers who will post pictures of boys that will post pictures of themselves on social media and kind of have to Photoshop it a little bit, where frankly, sometimes it doesn't even really look like them anymore. And not that there was anything even wrong with how they looked like in the first place, which then also creates this whole different dimension of how we relate to our bodies. Because now if you're posting a picture that doesn't look like you, and it's getting a lot of likes, which on one hand is like, yay, I'm getting a lot of likes. But if intuitively but that's not really how I look, then that doesn't get assimilated as confidence. That doesn't, if anything, it could be the opposite. Now people can feel, oh, well, people are liking this image of what I'm putting out there. So when does it start to get problematic? Because certainly all of us can relate to not liking some aspect of our appearance, or maybe having it get in the way a little bit here and there, or having those days, bad hair days and whatnot. But where it really becomes a problem is when you have those distortions in appearance. So it's now that you're seeing yourself in a very different way than how other people are seeing you. Your perception is very distorted. A lot of negative self-talk. I'm fat, I'm ugly, I look like a pig, I look like a weakling. Very, very harsh, almost like abusive self-talk, where one's self-esteem is resting on their appearance. So with patients of mine who talk about, despite being a straight A student and having a great sense of humor and having good friends, none of that matters if they don't look the ideal way that they want to look, where that preoccupation leads to interference in social, academic, and occupational functioning. They're not able to carry out duties in academic or their jobs because maybe they're spending way too much time at the gym, or they're mirror checking, or they're engaging in other unhealthy behaviors. And then certainly engaging in those unhealthy behaviors, excessive dieting, purging, laxative use, diet pills, compulsive exercise, steroid use, eating disorders, then we know that's clearly a line that's crossed. Now, with eating disorders, as we may know, you have anorexia, bulimia, binge eating disorder, orthorexia, which is actually not in the DSM, but refers to almost, if you think of it as eating disorders and OCD kind of colliding, where people want to eat perfectly. Now, that doesn't necessarily mean that they're starving themselves, but they get very caught up in what is clean eating, healthy eating, and sometimes that can very much go down the route of what looks like anorexia, because at some point you start looking at any food and ingredients and you can easily find something that's not ideal about it. ARFID, which stands for people who have avoidant and restrictive symptoms, but don't necessarily endorse a negative body image, like you'll see in anorexia, um, but nevertheless could be malnourished. And then what's all those subclinical eating disorders. Now, I want to clarify that term subclinical is sort of a misnomer because what I mean by that are all the eating disorders that might not fulfill the criteria of the above perfectly, with the DSM, and so are kind of under the radar. But from studies show actually that the majority of people who struggle with eating disorders and disordered eating fall into that category, of which the mortality rates are very similar. So subclinical does not mean more minimal symptoms. It doesn't mean it's less impactful on their health. It just, if anything, is just under that radar that often can be picked up, often in clinical settings. Now, with boys and men, when I started doing this research 30 years ago, there were very few studies that had looked at prevalence. And frankly, because they were only looking at men in clinical samples, there was a very small sample of men because think about, I mean, what it would take to even get yourself to a clinical setting when there were fewer resources, a lot more stigma and shame around it. And so now there are stronger epidemiological studies, and studies now that have been conducted find that about a quarter of people who have eating disorders are male. So it's 25% of individuals who have an eating disorder are male. And yet in clinical samples, we find about 0.05% of people in eating disorder residential and inpatient programs are male. So there's this wide disparity of men who get treatment. And I should also preface or mention that the rates of even women and girls who get eating disorder treatment is very, very low. So even in that population, but with men and boys, it's even lower. So at least 10 to 15 million males are affected by eating disorders. And again, that subclinical range, studies actually show that it could be just as common in males as in females, but again, not caught in the same net clinically. In fact, a study found that of a sample of men with eating disorders, 80% fell into what's called that not otherwise specified category. Now, for boys and men with anorexia that I've worked with, a lot of the issues could be very similar to what you would see with girls and women. With a lot of different comorbidities. Obsessive compulsive disorder, probably the most common comorbidity, body dysmorphic disorder, which I'll talk about in a moment, depression, social anxiety, PTSD, OCPD, or obsessive compulsive personality disorder. I've seen probably more common in boys with anorexia than when I have worked in the past with women with anorexia, and autism spectrum disorders. Also, I have seen with a high comorbidity of boys that I've worked with anorexia, which I would say, in my experience with girls, I wouldn't see as high. With bulimia, probably the most common comorbidity, and I am also an expert and specialize in the treatment of ADHD. I have ADHD myself, and really want to put out for any clinician out there who works with eating disorder patients to please always, always screen for ADHD when you have a patient with bulimia or binge eating disorder. It is highly, highly comorbid. And ADHD is also one of those conditions that is very misunderstood and often under the radar. It gets accused of being overdiagnosed. Its studies actually show it's more underdiagnosed. So ADHD, highly comorbid, depression, GAD, PTSD, and substance abuse. So how do they differ, eating disorders, between males and females? Typically, you'll see that men and boys will often have greater weight fluctuations and sometimes wild vacillations of weight in the course of their eating disorder. You'll also see sort of more history of premorbid obesity. Now, there's question of that. With a lot of boys, for example, right before they hit a major growth spurt, might gain a lot of weight. So some of these studies might be tapping into a period of time where boys actually report like, oh, I was super chubby, or I was, the fat kid, or very overweight. And maybe it was just the body readying itself to stretch in a vertical way. And at the same time, with a lot of the boys and men I've worked with, some of them do have a history of actually being overweight, whereas you don't see that as commonly with girls with eating disorders. And the biggest thing, even with something like anorexia, is most of the boys that I've worked with anorexia do not want to be skinny. Some of them do, but most of them don't. They would say, I don't like the way I look. I am emaciated. Like their body image is actually not distorted, but they also don't want to have body fat. So I'll often hear from my patients, if what I eat, if I knew it would automatically translate into muscle, I wouldn't have a problem eating. But you can't guarantee that. And of course, we can't, because the body has to create fat before it can convert into muscle. And there lies the dilemma for a lot of these boys that I treat. You'll see less use of laxatives and traditional diet pills, although there's a whole market of what they call these thermogenic fat burners that are all often seen in these natural stores or supplement stores that have high doses of caffeine or other amphetamines, some of which have been taken off the market years ago. And you'll also see increased prevalence of substance abuse issues in males with eating disorders, higher rates of binging, more using excessive exercise as a purging method, definitely less likely to seek treatment. And studies in the past would actually show that the prognosis for a man, a boy, or male with eating disorders was substantially worse than what it was for women. Now, that was erroneously sort of looked at back then, is that these men were definitely, in some ways, it was a suggestion that they were more disturbed on some level, that and so there was a much greater problem. That's not the case. That the longer you have an eating disorder, the harder your recovery is going to be harder. But you can never say never. I once worked with a man at 72 years old who was struggling with an eating disorder since he was 12, and he recovered at 72. So there's always hope, but it's harder. And if men are taking a lot longer to get into treatment, then it's going to present more severely. But that's not anything inherent about being a boy or a man as much as how quickly they get into treatment. With boys and men, sometimes we see the eating disorder in intersection with athletics, everything from dance to bodybuilding to football, swimming, and wrestling. That first study of eating disorders, I would get calls from college wrestlers who, I remember the very first call I spoke, and this young man said, I have a problem where because of wrestling, it really created this problem for me even out of wrestling season. And I said, oh, like, and I was curious about it. And he said, yeah, I could lose 20 pounds in 2 days and then gain 20 pounds in about 2 to 3 days. I was like, what? Now, I didn't know, my high school didn't have a wrestling team. I didn't know anyone who was a wrestler. I was like, what? And I would hear these stories from other people, and he would tell me these horrendously drastic things that he would do to basically lose basically every ounce of water out of his body, but doing other things that were super unhealthy that would get his weight down. And he said that practice of cutting weight and everything is just overall unhealthy, and which in and of itself is a whole other discussion. But even outside of season, he said he just couldn't stop. This is Joey Julius, who was a Penn State football player who very bravely came out and talked about his struggle with binge eating disorder. And I always want to just praise, the courage of anyone to come out and talk about these particular issues. But I think particularly in this space, we don't have enough men in recovery talking about this. This is Mike Margema, who was a baseball player. I'm not a baseball fan, so forgive me. I forgot the team he played for. I think it was a Seattle team. But that title on the bottom, Mike Margema overcomes eating disorder on path to MLB. There's a YouTube video, which hopefully is still out there, where it's like a 15-minute video where he talks about his journey with an eating disorder. And he gave up his baseball career to be an ambassador for the National Eating Disorder Association. Very, very powerful. Now, aside from eating disorders, in doing research in this field, I would get a lot of calls from young men who would say, I used to have anorexia or bulimia, And I recovered from that. But then I think I have something else that's still kind of like it, but I'm eating now, but I'm still just as obsessed with I'm eating, but I want to get big and muscular and obsessed with being muscular. So we sort of nicknamed this reverse anorexia and then changed it to muscle dysmorphia. And we coined this term muscle dysmorphia, which is now in the DSM, which is pretty interesting, cool. And what muscle dysmorphia is a subtype of body dysmorphic disorder where the preoccupation is in one not being big or muscular enough, and that can impair their functioning. So these often are coupled with avoidance behaviors. The guys who won't leave the house if they don't feel big enough, compulsive behaviors like excessively working out, mirror checking behaviors, obsessional thinking around I'm too scrawny, I'm too small, I'm too weak, reassurance seeking from other people. Um, about 50% of males with muscle dysmorphia will engage in the use of anabolic steroids. The other 50% have at least thought about it. High prevalence of depression. A third of them have a history of an eating disorder or an anxiety disorder. And just to clarify, this is very different than just being a weightlifter or even some bodybuilder, because we're not pathologizing weightlifting. And in fact, I did a study where we compared men with muscle dysmorphia to men who were avid weightlifters who did not endorse these body image distortions, and we found there were clear differences in comorbid disorders and occupational social functioning and self-esteem. Now, anabolic steroids are synthetic derivatives of testosterone, and the problem with it is they work, and they work well, in the sense that they can build muscle mass in a relatively quick period of time. The problem, however, is that there are a whole bunch of adverse physical and psychological side effects to it. Some are short term, like cystic acne and hair loss, gynecomastia, which is breast enlargement. But the problem, and I say the problem because a lot of people don't experience the short term effects, but many will experience the long term effects, which can include cardiac issues, psychological things like roid rage, which is a thing. People still question that there have been placebo controlled double blind studies by my colleague and co author of the Adonis Complex. We wrote a book together, Harrison Pope, and he's done studies of steroid use where people who were screened out for any history of mental health issues, when they were in a placebo controlled double blind study, were given small amounts of steroids, their aggression um, rose significantly. So steroids were just seen for performance enhancement. And then nowadays, the number one variable is body image enhancement and then performance enhancement. About 3 to 4 million people between the ages of 13 to 50, and that's right, 13. I've treated boys as young as 11 who have taken anabolic steroids. And it's much more common than people think. The problem now with social media is it's not only not, I mean, it's not stigmatized like it used to be. And sort of like what has been done with cannabis, where it's actually been almost seen as medicinal on some level. So the young boys that I treat are getting very different messaging about anabolic steroid use than the boys I was treating 15 years ago. But these were the guys that were pre-steroid, the kind of big bodybuilders of the time, and clearly would be dwarfed in comparison to the men today, where I'm not legally, I can't say that these men are pharmaceutically enhanced, but clearly big difference. So what do we need to do, and how do we outreach to talking about these issues more so that we have a better understanding of reaching boys and trying to get people who are having problems with these into treatment? So we want all the outreach that we see, and frankly, I think we need more with girls and with women, web-based resources, pamphlets, and something as simple as a pamphlet. I mean, I have a patient I'm working with now who's in college, and he said, in his counseling center, there's a pamphlet for body image and screening for eating disorders. And he opened the pamphlet and he goes, and all of the pictures are girls and women in there. And he said that just, it didn't make him feel very forthcoming to talk to his counselor that he initially started working with for depression about having an eating disorder, because even within that space, we can't assume that boys and men are always forthcoming about it. We have to give them that space. Screeners and screenings, having more men in recovery, awareness promoting activities, hotlines. A shout out to Harvard University has a hotline called ECHO, Eating Concerns Hotline Outreach, which is a hotline that students can call, and it's peer run and for eating concerns. And for almost 30 years now, I've been consulting with them in their trainings of how to reach males on campus, how to sort of interact with them when they call. And what I love about what they did is they sought that out because their premise was, well, men aren't calling this hotline. It's probably not because men aren't struggling with it. Maybe they don't feel invited to do that. So how do we reach out to them? And I respect them tremendously because they're very much about being inclusive to all different people that might have eating disorders. This is an image of me and actor, director, producer Justin Baldoni, and he did this webisode series called Man Enough, and this is the title if you type in YouTube, "The Ugliness of Body Image." And I promote this because I wish that everyone could see this because he talks in the episode about him sort of having some of these concerns, but he interviews myself and other experts in this work of men and body image. And then part of the episode is him and I think it's 5 or 6 of his male friends who are celebrities. One's a UFC fighter, one's an actor from the show Orange is the New Black. I'm really bad with names. One is from the Hamilton play. And they all have dinner together, this group of men talking about their body image. And these are men of different racial backgrounds, different ages, different generations. I thought it was so powerful. And so shout out to Justin for doing that and recommend anyone to watch it. But we need to educate physicians, dentists, physical therapists, mental health professionals that these issues exist with boys and men because you'd be surprised of there's still this sort of sense of really like do boys struggle with this. RAs in colleges, fitness instructors, I've worked with lots of coaches to help identify the warning signs that their male athletes could be exhibiting that could be indicative of an eating disorder. Parental education, so many times from boys that I work with, their parents who often feel very guilty, and I don't want them feeling guilty, who say, gosh, I was trained so well on what not to say or to be very conscious of comments I either say to my daughter or I say about myself in front of my daughter. And it never occurred to me to that would apply to my son. And so they feel very guilty when their son has an eating disorder. But I tell them, no, don't feel guilty. Culturally we aren't taught that in some ways. We're taught that boys are somehow immune to that, and they're not. We want to integrate it in courses, health class in middle school. Talk about male body image. When my kids were in middle school and they were learning about body image, I sent an email to the teachers and I'm like, I'm just curious if you talk about, boys and some of these things, and they didn't. And I gave them some resources and they integrated it, which was great. Research wise, there needs to be more research. Less than 1% of eating disorder research is focused specifically on male populations. We need to, I'm not saying it has to be 50-50, but it has to be more than less than 1%. Being aware that questionnaires and items on questionnaires are often geared towards women. And some of those questionnaires are very useful, but there have been researchers that have been developing questionnaires that are more psychometrically aligned with sort of the male body image. Just something, for example, that stands out for me is years ago, I remember in that college research study I mentioned at the beginning, someone said, what are thighs? It said, I'm dissatisfied with my thighs. He goes, what are thighs? And, when I pointed, he goes, oh, like, you mean like the quads? And he's like, oh, okay. And so even just the relation sometimes to body parts was interesting. Also, due to a lot of stigma, men don't often sign up for research studies. And so when I mentor young researchers who are looking to do research in this space, I tell them the wording, we have to be very careful with the wording. For example, I would never say, "Are you concerned about your body image?" For whatever reason, that phrase is still sort of stigmatized in some ways. But if I say, "Are you somebody that works out but are frustrated by your results?" I'll get a lot of people call. Now, a lot of the time, what happens is I'm getting a lot of people and I'm screening a lot of people out because obviously there are going to be lots of people who are frustrated by their results who don't fall into any clinical arena. So you likely have to cast that wide net. But there are a lot of obstacles to treatment with boys and men. Sometimes it's a denial of the problem. Sometimes they believe they're engaging in healthy behavior. And again, with boys that I work with social media, I feel like I'm arguing not with the boys, but with their influencers of social media. I have to become a consumer of this social media myself, even though I don't have any social media handles, but I watch some of this stuff through other means to know how to develop an argument against some of the harmful information that's being put out there. Um, Sometimes people point to media models saying, well, look, he's getting all this attention. He looks great. So what if it's impacting his health? There is a lack of eating disorder specialists that work with and specialize with boys and team services. And we know from studies that even physicians who are sometimes on the front line of identifying and making those referrals, the studies show that even when they're presented with the same symptoms actually, but where the gender of the person is male or female, that physicians are more likely to identify it as an eating disorder when it's a female patient versus a male patient, which goes back to that awareness. There's a lot of stigma with boys and men feeling like they'll be weak or that their sexuality will be questioned. They'll be labeled as vain, as attention seeking. And we know that many higher levels of care don't accept males. Now, there are wonderful programs that do, but just to understand that each of those obstacles plays a role in a lot of people that might have a hard time getting treatment. For adults, for parents, I often say, it's important for them to mindfully assess how their body image is. And in no way am I saying that they are to blame for their child's eating disorder at all, but just knowing that we send out messages as parents alongside peer culture, societal culture, and then individual personality traits and temperament that we just want to be aware of. And I'm just going to run through these to leave some time for questions. And then treatment is pretty much the same as what you'll see with girls and women. Psychoeducation, except that I find with the boys and men I treat, there's often a lot of talk around the role of masculinity, what it means to be a boy, a man, all of that, even in this day and age where there's a lot more fluidity and challenge around gender norms, which I think is a good thing. It still comes up a lot. This notion of what is healthy, and again, what is trying to go against and combat misinformation, frankly, and how to build a healthy relationship to food and exercise and body image. CBT, very, very effective. Obviously, nutritional rehabilitation and psychotherapy, which looks at self-esteem issues, potential trauma, and things like that, that also might play a part into it. DBT, which really could be helpful for anything. And then also understanding, like, from an acceptance point and commitment therapy point of view, what is the end goal? When I ask people, what are you hoping to achieve by having your ideal appearance? That's where the crux of the issue is. Whether it's, oh, I don't want to be criticized. I want to be liked. I want to be admired. I want to be respected. Nothing is wrong with any of those values. I tell people we all want to be respected, and who doesn't want to be admired? But it's disentangling that this means is not actually providing that. In number one, number two, it's harming you in the process. And of course, psychopharmacological interventions. Just a shameful self-promotion. So the Adonis Complex is a book I co-authored 25 years ago, which is crazy. And a lot of the information in that book, I would say, still stands. The only exception is it was before social media, so we don't have any chapter on that. A more updated book is Eating Disorders in Boys and Men, wonderfully edited book of various contributors, led by Dr. Jason Nagata, who does a lot of wonderful research in this space in California. And I will stop there and leave only 5 minutes, unfortunately, for questions. But here's also my email. So if any of you have questions that we don't get to, please shoot me an email.